ছিল
কি
ওয়্যারলেস নোজ। ডু ইউ হ্যাভ এ ওয়্যারলেস নোজ?
कुछ नहीं
তুমি আমাকে কেন বললে না?
यहाँ पे बस कुछ नहीं क्योंकि मेरा तो सिस्टम पूरे
मैंने तो
ऑटोमेटेड
वायरलेस माउस हटा दिया क्योंकि वायरलेस माउस में से इतना गिरता है ना, गिर गिर के मेरे अच्छे खासे पैसे खराब हुए हैं। तब से मैं ये लगा के रखते हुए गिरता भी है तो इतना ऐसे जाके लटकता है।
हो गया, लाइव स्टार्ट हो गया।
Okay, people will join after 3-4
या आफ्टर 3-4 मिनट्स। हाँ, लेट इट बी। हम इसको खुला रहने देते हैं। You want to remove the mouse or keep it there?
Okay, first
मेरे को दे दो। ये तो अब चलेगा ना? हाँ ठीक है।
you want something
बट पता कैसे चलेगा आपको मतलब क्या हो रहा है?
वो तो आते रहेंगे ना यहाँ पर
क्रिस्टियाना
नीचे आते
आप
रहेंगे।
क्रिस्टियाना हाँ इसको आप ऐसे बीच में रखोगे तो पूरा आएगा देखो बीच में रख के देखो तो इक्वल आएगा टेढ़ा नहीं लगेगा देखो आप दोनों आ रहे हैं लाइट और यू वांट दिस लाइट टू गो डाउन एक क्रिस्टियाना बंद करना वो पीछे वाला ये वाला तो उससे देखते हैं कि बहुत ब्राइट हो रहा है मे बी इंप्रूव द ब्राइटनेस हियर ये वाला इज इट बेटर या इज इट बेटर देन इट enhances this place
ये अच्छा लगा। इससे गुड एंगल।
आप भी लाइव जाना लाइव इन 1:30-40 सेकंड
Stream तो चलছে, it's
It is
live,
live.
we are live.
हाँ we are live। हाँ 2 people have joined। এই তো দুজন দেখছে আমাদের। হ্যালো স্যার, এই যে এখানে আসছে।
वॉइस साइलेंट कर then we can speak
Okay, cool. Just put in a message.
it's live yeah I say it's live Christiana says it's live
Okay. So I've written 12 messages. Okay, so 1 more minute to go and then we'll start.
so can I leave
Yeah. Absolutely. Let's start it.
আওয়াজটা যখন কথা বলে যান একটু জিজ্ঞেস করেন আওয়াজটা কেমন আসছে, কতটা আওয়াজ পাচ্ছে। আমাদের একটু বেশি আমরা কথা বলতে চাই
এখানে আনবো কি ল্যাপটপটা? Shit. No, I can actually. No. Still, are we audible? Can you check if we are audible? It's audible. It is clearly audible. হ্যাঁ দেবে তো। এখন দিয়ে লাগবে। तो लाइक या लाइक करना मेसेज करना तो
स्क्रीनशॉट lecture स्क्रीनशॉट नहीं अद्भुत असছে
Yeah.
WhatsApp message you sent. Why is it on?
Yeah. No worries.
Very patient.
You're just telling everybody to try out. Let's start.
Good evening, everyone. Welcome all who have joined, and people are joining still. So let me first introduce to you Dr. Maneesh Paliwal, and we have Dr. Manish with us and my friend JRA. I am Anindita, and today we are here to have a nice session with Dr. Paliwal. Dr. Paliwal is a gastroenterologist. He has a long track record of 19 plus years, almost 20 plus years, and he has been practicing all over the globe. As we were chatting with him, so we came to know he has been practicing all over the globe, and we are lucky to have him here at Siapa. And we hope that all the nearby neighborhood, the neighborhood of Siapa and its neighborhood will really benefit from his wisdom. And yes, yeah, let's take it forward.
Sure, sure. Great. So great to have everyone today at our live session. This is our second live session, viewers. Last week we had gone live with Advocate Robin Mujumdar, and it was a very enriching session for all of us. He had given some invaluable advice to people how to take care of our own legal systems or our documentation. A lot of advice on that, and it was pretty enriching, Anindita, right? So we actually thoroughly enjoyed talking to him. And today we are on our second session, second live with Dr. Manish Paliwal. He is now become our neighbor. He has his own clinic in CR Park, and he's a gastroenterologist. He is attached with the PSRI.
Yeah.
So he's attached with PSRI hospitals, and We did interview him last year also. It was a pretty good interview, and he had given a lot of inputs to our viewers, our residents, and it was, I think, people did enjoy that interview as well. So we thought that, why not do a live session with him where he can take questions live. He can actually give a lot of tips on how we can prevent certain disorders, diseases, or how can we actually be healthy, remain healthy sitting at home before visiting a specialist or a doctor. So, welcome Dr. Manish Paliwal to this live session.
Thank you, Anindra Vijay. So kind of you to give me an opportunity to speak to all of you. Good evening, I'm Dr. Maneesh Paliwal. I'm a gastroenterologist by profession, trained in Delhi and HGPKI Lucknow. I have a clinic in 40 by 60 CR Park, and I'm there for last 1 year. And currently, I'm a senior consultant at Pushpavati Singhania Hospital, Sheikh Sarai.
Okay, so that is all about Dr. Manish Paliwal. So I think Bengalis, we are inherently, I think, are born with a lot of stomach disorders. But
Because we eat lots of bhaja.
yeah,
Mishti.
we eat a lot of bhaja and mishti, and I think that is where the whole problem starts. But I think we Bengalis by nature we are foodies, so I think most of us are very scared to visit a doctor. What have you noticed? I think I know that we know that you've been in Calcutta for many years.
Yes, that's true.
So
My father was an army officer, so he posted in Calcutta. So my part of my childhood, I have really, lived in Kolkata, and I realized that every place, every 100 meters, 200 meters, you have a sweet shop. And all sweets are made of maida. And the other traditional good thing is every Bengali will eat rice and fish most often. But here in CR Park, I surprisingly see a lot of Bengalis don't eat fish and rice that much. They are more, chicken eaters. So that's a good thing. Now, all of this I know has led to constipation and a lot of GI disorder. The other good thing is all Bengalis love to eat a lot of fried food.
yeah.
And that's fine. Anything tasty is always fried. And I can't say everything is unhealthy, but a part of it is mostly true.
True. Actually, yeah. Most of the tele bhaja of Bengalis are of maida, and they are deep fried. So
Apart from being deep fried, the biggest problem is that the same oil is being used again and again and again for frying. That is the culprit.
that's a culprit.
That's a big culprit.
Because the oil gets saturated when
Yeah.
you burn it even once.
Yeah.
So, but I think, doctor, what I feel is, because I also have lived in Calcutta, and now, of course, I've spent my entire life in Delhi. And I've seen that Delhi Bengalis have different food habits,
Yeah.
and Kolkata Bengalis have different food habits. What do you have to say to that?
Yeah, because in at Kolkata, what I know is people don't eat too much spices, if I'm not wrong.
Okay.
And in Delhi, they have not only traditional Bengali food and they indulge in that, but they've already lots of other Punjabi food and tandoori food, and they've actually now got into the mixed culture. And
Yeah.
of course, that goes without saying. They are yet to find, I would say 1 out of every 100 I'll find people say that they don't have love to food. So most of them, say they have love to food. They want to eat the most tasty food. It's okay, but sometimes you have to draw a line, I believe.
True. So I think there are certain basic things that today we can talk about, Dr. Paliwal, wherein, with certain basic food habit changes and some lifestyle changes, I think we can prevent
Yeah.
a lot of disorders from happening. But today I think I feel that today we can talk about a very funny, and I think a movie was also made on that.
Yeah.
Remember our Bengali obsession with our bowel movements?
Cool.
Yeah. So, so I think we'll talk about that where we'll talk about constipation.
Yeah,
I think
open
it's a favorite topic of Bengalis.
Yeah. It's a topic of discussion in the morning with my mother-in-law. That's the morning the topic of discussion. And initially, when I was married and came here, so I was like, in our house, it was not discussed as such, but in this house, it is every morning there is a topic of discussion. Even at other times of the day, it's a topic of discussion.
No, it's very
So
truly
that's-
said, no? आदमी का इमोशन उसके मोशन से
Motion
जुड़ा है.
Yeah.
which is very true. I
Which
think
is very true.
I think even non-Bengalis will agree that but I guess the food habits are different for non-Bengalis, wherein they don't have an issue with that per se. They don't have to think about it.
So we say foodie and moody. So the
Yeah.
foodie is fate and moody is your head.
Yeah.
So they are connected. So the gut-brain relation.
Yeah, and I think it's psychological where you get very much influence if if your gut is not clearing out and you get very tense, and I think there's a lot of stress that gets built up with that. So what do you have to say to that, doctor?
Look, today if we say there is constipation, now a lot of people think constipation is a disease. Actually, it's not a disease. It's a disorder. And constipation means a lot different to different people. And as a doctor or as a patient attendant or as a relative, I have noticed that it is the distress caused by constipation which is a bigger problem. ज़्यादा बड़ी problem है. It's a bigger challenge. So constipation, if you look scientifically, it is like not passing stools for a day to sometimes up to 3 days. That is the classical definition, but that doesn't hold true in India. In India, constipation is, if you consider what I see in my practice every day, is if you are straining a stool, जोड़ लगा रहे हैं, yeah, you feel the stools are very hard, difficult to pass. You have to use some kind of maneuvers, press your tummy, press the upper part of your tummy, move yourself, drink a lot of liquids before going to the washroom, and you feel that the motion is stuck in the back passage. So that all is constipation, what a common man perceives, and this is exactly causing a lot of distress and a lot of maneuvers. A lot of people are experiencing this. I would say at least 25% of Indians do in their lifetime suffer from constipation, either during childhood or during adulthood or during infancy. And for 2% of the population of India, 2% India की population में constipation is a very recurring problem. Now you imagine the gross proportion of this problem in India. So it's an immense problem, and again it is not a disease. Constipation एक लक्षण है, एक symptom है, ये बीमारी नहीं है. It is always because of something and not necessarily per se the first disease. So the first thing, if somebody feels that he has constipation, एक चीज जरूर सोच लेनी चाहिए कि ये मेरे को बीमारी नहीं है, ये मुझे एक परेशानी है, and we can definitely overcome in a lot of cases. We just need to find out what's going wrong and why.
So which means that the common perception, doctor, is that people think that chalo it's a way of life, hua nahi hua. They feel shaky, they feel hesitant to even talk to a doctor for these symptoms. And say चलो कोई बात नहीं, आज एक laxative ले लिया तो हो गया, कल फिर दोबारा ले लेंगे, and that is how
So how often should we take a laxative?
देखो,
and is that a correct way of treating
see,
it also, doctor? That's not.
let's look at it this way. Now, depending on what is your age, if you have a child or a toddler or young adult or even an adult, you get occasional sense of constipation, you feel that you're not able to pass a good motion, that's not going to be a problem. You can definitely start thinking of taking some home remedies. You can start thinking of finding out what is going wrong. Many people have insight what they are causing constipation, because I regularly ask people, do you know why you have constipation? Do you think why you are having such difficulty in passing stool? इतनी परेशानी क्यों हो रही है? A lot of them will tell me, हाँ doctor, I know I have got poor lifestyle. हाँ, I know doctor, I don't eat fiber. हाँ doctor, I know I am not taking enough liquid. So people have insight. The first thing is, ask yourself, is there something in your mind you are doing or you think? Today is the internet era. Everybody Googles or everybody looks at the internet for information. So information is there on the internet, but it does not give you the accuracy. So if you know that this problem is only 1 or 2 days,
Hmm.
take something, ask yourself what is going wrong, try to correct it. Majority of them will feel better.
Acha.
But if this constipation starts occurring anybody above the age of 45 is a persistent problem, it is definitely increasing.
Hmm.
There is पेट में दर्द या पेट में दर्द हो रहा है या pain in the tummy, you feel you are losing weight, or you feel that this problem is persistently increasing,
Hmm.
and I take medicines and I take some local traditional things, over counter medications which are very easily available. Many people have tried Isabgol, Trifala, it doesn't go away, and sometimes they feel that they have passed some blood in stool, okay, and they feel that the tummy size is increasing. Kindly meet your doctor, meet a gastroenterologist, meet a physician, whoever you can trust, but meet somebody. So those are the groups, what we call an alarm symptom. Never ignore, never self-medicate, try to seek help. Maybe everything is found out to be normal and then you can continue your way. But it is very important that you once meet. If you are not meeting, sometime we can miss certain problems which are ultimately going to lead to a lot of difficulty,
So you are
and they should be seen.
okay. So you are saying that in case it is a persistent problem, and there are certain other symptoms
What
which
we call
are
alarm signs.
alarm signs which are not comfortable, then one should see a specialist or a physician.
Especially there is weight loss, blood in stool, persistent pain, and it is increasing quite rapidly. Then definitely it is a clear indication at whatever age, whether you are young or old, must see a doctor. You must see a doctor.
So, what about multiple evacuations? Like at one go, you are not able to
Clear it out.
clear it.
You see, this is also part of the thought of a lot of people around the globe, that they should pass stool in one go, their stomach should be perfectly clear. Now, there are many aspects to this. Many people are not able to, clear their bowel or clear their open their motions in one go, have physical limitations, they cannot sit for long. Other is people don't have patience, they are not going on regular timings, they are not fixed their timings. So those are the people who will think quickly they should finish motion, and that doesn't happen. The body will take its time. It will take 5-10 minutes for it to properly empty, and there has to be regularity. Many times people have physical disorders in the motion area, where plus there are multiple illnesses where you will not be able to empty your intestines in one go. In those are the group of people, if it is progressive, it should be evaluated. But in majority of them, especially the younger people and who are not straining much, it could be okay. Find out whether there is regularity in your timing, whether the stools are hard, whether you have to use some manual pressure on your tummy or the back passage to take out the stool. That all is abnormal. Such people you need to check up, but majority of them up to 2 times or 3 times. You see, there is something known as gastrocolic reflex. Now, many people get up in the morning and pass a stool, then they eat something or drink tea, and that increases the movement of the tummy, the intestinal muscles, and leads to evacuation. That is perfectly normal. So some people feel that after breakfast they have to pass a stool. That is perfectly normal. Every person from their childhood would realize what is the way they are going to that is best for them. Now, if you are since childhood going to the washroom 2 times, once in the morning, once after tea, once after breakfast, that is normal.
That's
You don't have to worry. But if it is becoming too progressive, like you have to pass 5-7 times, that may be worth understanding more.
And it is very important to maintain a certain time frame
Exactly.
where you should be managing this whole system, whether it is having tea or after breakfast, whatever, it should be one particular time, so that it is a regularized process and it doesn't hamper your daily schedule. I think because sometimes what people do is, they have urges even if when they go to work or school children, they also have urges, and that becomes a problem sometimes.
Exactly.
When you
So
are on
you
the
see,
go.
our body has what we call is a biological clock, rhythm, which we call circadian rhythm. No, we all sleep at night. We all wake up in the morning. So we have a clock in the body, and the whole system works like a clock. Even our intestines, what we call is movements to pass stool, पेट की आंतें एक पर्टिकुलर टाइम पे काम करेंगी मोशन पास करने के लिए. तो अगर आप लोग उसको नहीं करोगे सो होबे ना. That is true. Other thing is, you see, lot of people, we know that if we go for international travel or travel, we are not able to pass through. This is the reason why our timing is off. Sometimes, if we are postponing our call of school, we are very busy, we have to rush for work, then this problem will ultimately lead to constipation and our feeling that we have not evacuated adequately.
How to bring back? A lot of times we see that, okay, there are people who are very busy, and they have been going to office at odd hours, they have been coming back home at odd hours, and like you said that when people travel so frequently, but then once sometimes after a point you have to bring it back to schedule. How do you do that?
You see, the best part is like, ask yourself what is normal for you. Then try to plan what is normal for you. Most people today in the Netflix era watch Netflix late, okay, and they will definitely snack after dinner. A lot of people, and then they want to get up and go to work early morning or early. They don't give this 15 minutes to motion, which the body will require. If you are eating well, you need to evacuate adequately, and then over a period of time, this will lead to a problem. So the best part is set up a time in your mind that I require 15 minutes for my colon to empty. मेरी आंतों को खाली करने के लिए 15 मिनट चाहिए है मेरे को. That time I should postpone or take out from my schedule so that I don't get into the habit. One odd day the body will accommodate, but if अगर कोई हफ्ते हफ्ते करेगा तो it will take a lot of time for the biological clock to settle back and pass us through.
शुरू में जब वो सेटल होने लगता है तो टाइम लगता है, when it becomes when you are trying to bring your body back to a schedule, उसमें तो थोड़ा बहुत टाइम तो लगेगा. I think 3-4 days you will need that time to get back into that schedule. I've seen that with my family, some of my family members, and it becomes a problem.
True.
So another question I have heard that if you are not emptying and if it's there like that, so does the body absorb the toxins back?
Look, no. The body would not absorb any toxin, but if you postpone your stool for long, the movements are poor, then what happens? The water gets absorbed out of the stool, and that leads to really hard stools.
So the
And
water
that
that
is
is absorbed, that is okay.
Yeah,
Not toxic.
that is intestines. You see, our intestines always have bacteria. The intestines are never sterile. They have bacteria. The good ones are majority of people, and a few bad ones. And the body is maintaining them. So that is not a problem.
Okay.
So I'll all like to tell people one thing. I like to show this chart. What we call is the Bristol stool scale. I like to show the viewers. You see. This is the standard chart which every gastroenterologist uses if somebody has constipation. What we call a Bristol stool scale, developed in UK. Now here we've got first, second, and third. This kind of stool where it is like hard nuts, or it is a large thick stool with some cracks, or a very thick stool which is surface cracks, usually is the problem of constipation. Many people may complain of the 4 and 5 type, which are otherwise normal as constipation if they pass a lot of time. But usually the first 3 are constipation. So if somebody has this habit of 4 and 5 and then goes into 1 to 3, then definitely look into all the aspects of lifestyle and all the aspects that why have you developed it. So I think this is worthwhile understanding that if you have, if forever you are passing 1, 2, and 3, then and you are okay with it, then it is fine. Otherwise, traditionally throughout the world, we call that as constipation. 1 and 2 for the the developed world, and 1 to 3 for all the developing countries. Yeah.
Okay, great. This is a good piece of information. I think we can take a picture and we can post it also on the YouTube. So, doctor, another question. When people have suffered from constipation for many years, and it becomes sort of a chronic disorder, and we get to hear from a lot of here and there. I mean, that this cannot be cured, or if it's a senior citizen, somebody who's above 65 or 70, उसको क्योर नहीं किया जा सकता. What do you have to say to that, doctor?
Like as I say, at every age, constipation has its different meaning. So if you ask particularly for somebody above the age of 65, so if a senior citizen or a person has constipation for many years, feel that there is constipation for several years, and now he's continuing into his old age, that may have a different meaning. But as I said, that if a senior citizen develops constipation at the age of 65 plus, the first thing you have to do is get a proper checkup to be sure that this is nothing abnormal. That would be the first thing to do, that there is nothing abnormal. The second thing which you have to do is, once that is there, you don't have to get disheartened. Most senior citizens have constipation because of few reasons which are not too much. One of them is poor mobility. So if you are not moving well, you will not have your bowel movement, because movement, including just something like increasing walks, improves the bowel. Second is, many senior citizens don't have adequate teeth, so they are not chewing, so they are afraid of eating fibrous food, which would lead to more of soft food intake, and that has no fiber, and they will lead to constipation. So you can help yourself here. The third group are one who usually have a lot of illnesses. Somebody is treating for diabetes, somebody is treating for blood pressure, somebody is treating for some nerve issues, neurological issues, heart issues. And there are a lot of medications, and medications are among the commonest cause which have side effects as constipation. So, for example, many medications in diabetes, many medications of blood pressure, many medicines used for heart disease, for cholesterol, have a side effect of constipation. So, it will be dependent on what you have.
So over a period of time, you develop that as a side effect when you are having extended time frame of having those medicines regularly.
Yeah. So what we do as doctors is that we would definitely look into all that group of medications, understand the importance. Please, one thing is very important: do not stop medications if you Google it and find out that this causes constipation. That is quite devastating, because the reason why you are receiving that medication may be more important than understanding the side effects. What we call is the risk benefit. So if your risk of blood pressure shooting up and causing a big problem in the brain, it is better to take a medication if it has been properly prescribed. In such cases, we start giving medicines to help them relieve with constipation, and that is the best approach. So we try to trade off. So if you are having 5 medications which can cause constipation, 2 of them can be avoided or substituted. So a doctor would, like me, like a gastroenterologist, I would like to inform that patient, please ask your doctor, I find these medications can be substituted, and if they are simple ones, I try to substitute them myself, or which is very easy because we are all trained in internal medicine.
Sure.
Or we ask them to change, and that's the best approach. So never change your medications on your own, especially if you feel constipation. Don't blame yourself. Best part is to go, and it's worth discussing with your
or the physician who has prescribed those medicines
the same
to
doctor,
you.
whether it's a cardiologist, a neurologist,
That I'm having
a
these
physician.
problems.
So that is very, very important and relevant. So that is a very important thing.
Exactly.
So for these patients, maybe a lifestyle change can be also advised, and like we were
More intake
talking.
of fluid, like
Yeah.
more intake of water.
Yeah.
If you are having so many medicines, anyway your body becomes tend to become dry. So
Yeah.
then you should be having a lot of
And
fluids.
lots of people think that, like even senior citizens, but even youngsters these days, they skip breakfast thinking that
Yes.
we are going to become lean and thin, and so skip
Yes.
breakfast. And this thing of this 14-hour fasting, or what is
Yeah.
called intermittent fasting,
Intermittent
has come
fasting.
up. So, what do you have to say about that?
Yeah.
About skipping breakfast or having
And
breakfast,
these
or
all
this
these
intermittent
fat,
fasting,
yeah,
this
all
fat
these
diet?
fat diets.
Look, so a little different from constipation, but I'll tell you
And
traditionally,
they probably influence constipation in the long
yeah,
run.
exactly. So lot of nowadays there are a lot of crash diets, lot of food fads. All these are issues which have cropped up and are used by people who think they have a problem. Some people think they want to get into shape. Some people think that these foods will affect their tummy. A very common thing is a lot of people who are in a hurry will have a toast and a cup of tea and go to office. Now that's not anything. So when you start your meal, you a day, your body requires energy. So breakfast is considered a very relevant and important part of it. So you should have some healthy snack. It could be little bit protein, some carbohydrates, if possible a fruit, depending on whether you like it or not, and whatever you is cooked in your house, but definitely some protein, some fiber, and it should have adequate calories because that gives you the energy to move on. You can decrease the amount in your breakfast, lunch and dinner if you really want to lose weight or increase physical activity. So, but if you will skip breakfast and try to maintain, two meals, then after a few days you feel so hungry that it is very difficult to lose weight. And traditionally, as there is data, it says that people who have regular meals, smaller meals, and changing their pattern of meals would lose more weight with exercise rather than somebody who's doing intermittent fasting. Intermittent fasting has been there around for now last 10, 15
Yeah.
years, and there are enough harms which are coming in. There is no data, there is data which says that harms are there. So it all depends what you are doing and at what age are you doing. You can't really read up the internet or look at Instagram and take a decision that I should do this. That might really impact your body
Seriously.
and push you into an illness.
So it is better to have five small
Three
meals,
to five,
3 to 5 small meals,
small.
and exercise well, and maintain a walking schedule or a brisk or a running schedule, whichever suits you, and of course then be in consultation with your physician and doctor.
Yeah.
So I think what I feel is I have seen with some of my family members that how they have been suffering for many years from constipation, and they have just kind of pushed them under the carpet, which most I have seen most Bengalis do. They don't like talking about their internal problems with doctors. They feel scared. They feel very apprehensive. How to get over that that mindset, डॉक्टर कि डर लगता है नहीं जाना डॉक्टर के पास
No,
क्या
I
बोलेगा
don't think so.
डॉक्टर
I don't think so. That's the right mindset. What I feel is feel comfortable. Everybody who is watching YouTube today is tech savvy, and I don't think you should feel scared about it. And it is worth going discussing in private whether you want to come to a clinic, whether you want to go to a hospital, whether you have faith in your family physician. But it is important to understand and discuss. At least once, especially if you're senior citizens, once or twice, you should get a complete evaluation. Many times in senior citizen, as a gastroenterologist, I do advise something known as a colonoscopy test, which is the camera test. This is the best test to do, endoscopy from the back passage to look for any problems in the large intestine or colon. Especially if I don't find anything wrong in their medicine history and I see what I call alarm signs, when I say they have lost weight, when I say that they have become, hemoglobin is falling, when I see that they give a history that they had passed blood, when I see that they have a history that there is a lot of pain in the tummy, when they see that they have enough weakness, or somehow they are not improving with common medications. Definitely, there is no case of hesitance, because what will we gain out of hesitance? We may be developing a problem. Unfortunately, a few of us may be developing a tumor. A few of us may have some kind of intestinal issues which can be totally cured. Early cancers today are totally curable. They can be handled properly. So there is a lot of expertise, and you know there is no requirement to feel anxious about it. We are living in an era of technology. We are living in an era of information. It's definitely worthwhile to once visit and get rid of a problem. And again, I want to emphasize, majority of elderly who feel they have constipation, can majority of them be simply handled with a few tweaks here and there. Some medication change, some lifestyle change, some new medicine intake, some proper test and evaluation, and it is very reassuring that I'm fine, because fear in elderly about diseases, fear about cancers, fear about other problems is always there, and I daily see this. So here, at least in CR Park, in my clinic, I do come across people at the age of 88, coming to me. 2 days back, I had elderly Bengali, very well read person who texts me sometimes, and asked about himself. So I think we should get out of that fear, and it's worth exploring that whether I can be properly helped. I think that is very important.
What is your experience, doctor, in the past 1 year that you've been here in CR Park? What has been your experience with patients, with senior citizens, with elderly patients? Just tell us more about what has been your perception about Bengalis?
No, I have no doubt Bengalis are among the most intelligent breed on earth. I have no doubt, no? And I know that you can't really tell them not to eat sweets. You need to ration them how to eat
Yeah,
sweets.
you need to work around with them.
Exactly. So and you need to ask them first, what do you think is your problem? 50% of identify their problem. Try to help on that. Try to give them a proper explanation. That's what I want. Give time, and that is what I think helps majority of people, including Bengalis. And of course, uh, talk to them what is troubling them the most, which I always believe in every person. That what actually is troubling you? Why are you so troubled with constipation? And look at their biggest fears. And that is what I think every person would require. Bengalis, yes, since they are a very intelligent breed, CR Park is full of the most intelligent Bengalis, which I am used to, and I have experience of a few Bengali friends, their relatives, their families. So I think talking to majority of them and trying to explain them is the way which will work, which I think would work with everybody.
Right, true. They have come. I mean, you've had good experience with Bengali
Yeah.
patients, and
Yeah.
they've come and consulted you.
Yeah.
Senior citizens have.
Yeah,
Because I think that is also very important for us to tell on this live session that you've had good people, good patients coming across to you and opening up with you
Exactly.
on their problems.
And especially with Dr. Paliwal, he is such a nice person.
Yes.
He talks so softly,
Exactly.
and just he will make you
Absolutely
comfortable.
comfortable.
Yeah.
Absolutely. I think that is very important. And viewers, I think please do come and consult him. And I think it is very important, like he said, that unless you discuss the problem, you cannot have a solution to that.
So I will now, try to bring in some home remedies for you people now.
Wonderful.
Let's talk on home remedies. Now, please understand these home remedies are usually effective in only short-term constipation, or some people who have chronic problems and they have been adequately evaluated. That there is nothing sinister going on. Their medicines have been checked. That the medicines are not the culprit. Their lifestyle has been corrected also. That the first thing is ask yourself, do you eat enough fiber? So if you are eating a good amount of fresh food, fresh fruit, green leafy vegetables, wheat. If it is not troubling you, many people feel bloated with wheat. Then, or salads. That is the first thing. Then second, look at the amount of liquid in your diet. Now it should be non-caffeinated, not cold drinks, not juice based. Yes, in Western countries they look at juices, but in India, water is something which everybody likes. Every majority of people drink a lot of water. See to it that you are drinking water adequately. 2 liters is enough, but only advice is this for people who have heart disease or kidney disease, where the doctor has told them to take, lesser amount of fluids. For them, it is where you may ask your doctor. Third is try some home remedies local. First, like it's something like you can eat guavas. Guavas are very rich in fiber. It's very easily available. Nowadays, kiwis are grown in India and they are very easily available. They are high in fiber. Then avocado, although quite expensive. Papaya. A lot of people eat papaya, but it is not the best. The second is only in summers bail is available. Banana, watermelon, apples, strawberries. Strawberries are very rich in fiber. Most people don't know that strawberries are very rich in fibers. Majority of the berries, pear, they're all good food. One very important food is, although it's very high in calories and sugar, is fig. Fig is something which if you can, eat 1 or 2 in a day, and if you don't have sugar or other problems, then fig is a good way to relieve constipation. Many people have flax seeds. Flax seeds is a good way. Sauf, bunui sauf, moti sauf, that is a very good fiber. And of course, every grocery shop will have isabgol. So you can take isabgol and consider that as, because isabgol is a traditional thing.
And it will not harm your system also.
But please remember, this has to be only, these house remedies has to be only for short while. If it doesn't help you over a week, 10 days time, please meet a doctor, especially if you are in the elderly group or an adult and you think your symptoms are increasing. And of course, that would be important.
Right,
and of course, try to consider to meet a physician or a gastroenterologist like myself. Whoever you think is close to you and, especially who would help
you.
Yeah.
I think incorporating fruits and fluid in a diet will actually go a long way, isn't it, doctor?
Yeah.
I've seen with my family members, some of my family members, that when they have their regular fruits and nariyal pani is, I think, a very good hydration system. If you have it on an empty stomach, I think a lot of your stomach problems are. Nahin?
I don't know, but yeah, it is nothing bad. It's got good minerals, some calcium,
right.
And it's
unless you have
hydrating.
high sodium and potassium,
And it is natural.
It
is
natural.
better than aerated drinks. It is got low sugar.
Exactly.
So that I think is good.
That is good, and then of course if you have oats or dalia, those are also very good system cleansers.
Yeah.
And especially senior citizens also gain a lot of energy from that.
Exactly.
So,
oats are very healthy. Oats are
very
among, I feel, superfood.
Yes.
And oats are very nice. Then, chia seeds are good if you have. Even nuts, with the peel, if you can eat, is good source of minerals, protein.
Almonds भिगो के रखो आप पहले दिन और अगले दिन you can have that. So I think and अभी डॉक्टर मनमोहन, I want to ask you कि जैसे मोरिंगा के balls अगर हम बना के रखते हैं, हल्दी और मोरिंगा के balls, do they help in digestion also? Do they help in cleansing the system?
Lot of people think that it is a system cleanser because it leads to increase in the motility. It increase आंतों की चाल को थोड़ा सा increase कर देता है, and it makes sense. Little bit. Yeah.
So that can be had on an empty stomach, and then you can have some warm water, lukewarm water, and you can start your day. Instead of starting your day with tea, you can actually start with a lukewarm water with honey, and that can also
lemon is also considered
lemon
good.
and honey, and then you can carry on with your breakfast.
It all depends what you have liked and how your system accommodates.
Right. But these are home remedies which people can adopt.
Yeah, they can attempt. They should attempt. Everybody should attempt because it is worthwhile giving yourself a trial, especially if you don't have any alarm symptoms. As I always say that please always note, if you have severe pain, your symptoms are increasing all the time, you get bloated too often, the constipation is increasing, especially if you feel you have, type 1 or type 2 which is increasing. Yeah, type 1 and type 2 which is increasing, especially type 1 and type 2 which is increasing. You have passed blood. Important is that you have lost some weight. Even if a young adult, 40s, 30s, loses weight because of constipation, those are the people who should seek early advice. And of course, I would say senior citizen, it is always worth once visiting a doctor, your physician or a gastroenterologist, understanding everything is okay, checking up on your medications, and then try these home remedies. That is always worthwhile.
So great, doctor. I think it was a wonderful session. नहीं
Yeah.
बहुत मजा आया आपसे बात करके. It was fun, and I think I'm sure a lot of people will benefit from this live session. It's going to remain on YouTube, on Siapak Speaks YouTube channel. People can view it later anytime. It's going to be there forever. So that's the benefit of doing it live on YouTube. And doctor, you were talking about doing some subsequent sessions also.
Yeah, I'm planning to speak on also fatty liver as a problem, and what is fatty liver, whether is it important for us, can it be dangerous, and subsequently I'll also have a camp in which I will be doing fatty liver assessment. I'll post it soon and I'll let you know, and then we can always talk on that. See, fatty liver is a very common problem. Liver problems are today among the commonest rapidly progressing illnesses. Fatty liver actually is a disease. If it progresses, it can lead to really big problems. So I want to discuss on that, and I think it makes sense to educate, and I'll soon come up with that.
Sure, sure. Great. Thank you, viewers, for joining this session, and I'm sure you will have benefited it. You can see the video very shortly after it's uploaded in about a few minutes. Thank you so much, Dr. Manish Paliwal, for joining us on this live session. We'll have some more of that in the near future with other subjects. And thank you, Anindita. Thank you, viewers, and good evening and good night. Thank you.
Good evening.
Questions का क्या बोलूं?
Questions